Good afternoon, everyone. Yate shike do shidine she Corina Sabiku Yanishia Tachitni Nishle Hoathlana Bushishteen Tohaglini Deshache Maitishni Deshanella. Good afternoon, my friends and relatives. My name is Corina Sabiku. I am Navajo and Jemez Pueblo. I'm from the Red Running into the Water Clan, born for many Hogons. I am a senior research program coordinator under the Center for Health Equity and Community Engaged Research at Mayo Clinic, located here in Rochester, Minnesota. I want to welcome you all to the Indigenous Health Topic Speaker Series. So as a part of our center's Native American community outreach efforts to engage tribal health, we host this event, which is focused on hosting speakers who are local, regional, and national experts in health, education, and research. These presentations are focused on topics that have an impact on our Native American and Alaska Native communities. All of our presentations are recorded and posted on our internal and external website. I want to thank you all today for joining us to listen and learn. Before we get started, I would like to go through a few housekeeping items. So we will have time at the end of our presentation for Q&A. Also, between 1 and 1:30, we will have an informal discussion, which won't be recorded, just giving you all an opportunity to ask questions more in depth with our presenter. So I will be posting a separate Zoom link towards the end of this webinar. So feel free to jump on if you do have time. And also, if you do have questions throughout the presentation, please add your questions to the Q&A and we will get to them at the end of the presentation. So with all of that said, I would like to introduce our speaker, Lexi Winfrey. She is a med student here at the Mayo Clinic Alix School of Medicine located in Arizona. So today she will be speaking on a Mdewakanton, Dakota journey from the res to medical school. I will go ahead and pass on it over to our presenter. If you want to go ahead and share your screen.
All right. Thank you so much, Karina, for the introduction. So like Karina mentioned, my name is Lexi Winfrey, and I'm going to be speaking a little bit about my journey into medicine, how I chose to go into this field in the first place, and kind of what this path has looked like for me so far. Can somebody confirm that you're able to see my slides for me, just to be sure?
Yes, looks good.
Okay, great. Thank you, Chad. So just a little bit of background about myself. I am from the Prairie Island Indian community, which you can see down here in the lower right corner of the map on the right side. It's just about an hour north of Rochester. So I grew up near the Minnesota campus for the Mayo Clinic, grew up very familiar with the clinic, both as a patient and as a relative of many patients. And these images on the side here are just to kind of give you a picture of what my community looks like. So at the top here, there's a photo of our annual Wachipi, which is held in June each year. That's our powwow. And then below are some photos that kind of paint a picture of what our reservation looks like. Mdewakanton actually means born of the water. So you can see the river here down in the left corner. I grew up just a few minutes away from our tribe's buffalo project. And then the lower right corner shows just a picture of a sunset from my parents' house. So it's really beautiful and I miss home quite often. So moving forward, before we get started, I just wanted to give a big thank you to Karina and Guthrie, who can't be here today, for inviting me to speak on my experience. This is the first time that I've ever, been given a platform like this, and I'm really excited to share with you all today and just happy to be here in general. So we can go ahead and give you a better picture of what home looks like for me. On the left, this is my whole family. This picture is a few years old. As you can see, there's quite a few of us, so it's hard to get us all together for a photo. but I was actually raised on the reservation by my parents, Victoria and Norman Winfrey. They actually adopted me from their niece, and this is a very common occurrence among many Native American communities to kind of have blended families. So you can see my 3 younger siblings here who are also adopted, as well as my older brother, Martin. And I like to think that having this wide variety of age ranges amongst my siblings keeps my parents young, keeps my family interesting, and there's never a dull moment. So here in Arizona, you can see a photo of my friends on the right here. When I'm not in school, you can usually find me with them, or you can find me just being a crazy dog mom to my puppy Jelly Bean that you can see here in the lower right corner. And just a bit about my history. So I actually graduated from the University of North Dakota, which is about a 5.5-hour drive from home on the reservation for me. So moving to Arizona was a big jump, but I'm very, very happy to be here. Although I did grow up near Rochester, I was ready for a bit of a change of scenery, which is how I ended up here. And, you know, I may or may not end up back home or staying with Mayo, Arizona. But regardless, I'm very thankful for my time here in Scottsdale. And before I get started with kind of the nuts and bolts of my presentation today, I just wanted to take a moment to do a land acknowledgement. So I think that it's very important to acknowledge the people that tended the lands that I'm presenting to you from today. I'm currently in Scottsdale, Arizona, which is the homelands of the Hohokam people. This is a group that actually gave rise to 2 tribes called the Akimel and Tohono O'odham. Eventually, these people provided refuge as well to the Peeposh as they were forcefully removed from their homelands closer to Colorado. And I just want us to remember that their ties to this land were established well before European colonialism, and it's thanks to their tending to this land that I'm able to benefit from it today. And I hope that acknowledgement of this land and as well as the people who tended to it can serve as a reminder to us that we can respect Indigenous ideologies and to remember that those who practice those ideologies are still here alive and well. So this is just an overview of what I'm hoping to discuss with all of you today. I want to give a picture of kind of why I went into medicine and how my home life and growing up as a Native American woman has influenced my journey into this field, as well as highlighting a few obstacles that I've faced along the way and how I was able to overcome those obstacles and to learn coping mechanisms throughout my time in medical school. And then lastly, I just want to highlight a couple of initiatives that the Mayo Clinic specifically has been taking in recent years to kind of make amends and pave the path for future Native American medical students like myself to continue getting interested in medicine. So to begin, why medicine? How did I end up in this position in the first place? A few of the main reasons that I want to discuss with you all are my early exposure to the field of medicine in general, as well as all the individuals who have supported me along the way and some unique resources that have been available to me that have allowed me to pursue this dream of mine. So when it comes to my first exposures to medicine, I kind of broke it down into 3 different umbrellas. And the first thing that came to mind for me is my exposure to health issues and medicine in general at home. So like I mentioned, I did a bit of foreshadowing earlier on, but I did mention that I was adopted by my great aunt and uncle. This means that I was raised by parents who are quite a bit older than individuals who typically have children of my age. And you know what this meant for me growing up is that although I'm very lucky that my parents' health overall is wonderful, especially given their age, this still meant that I was forced to kind of see their health decline a little bit earlier than most children typically do. So, for example, my dad has had diabetes my entire life. He also had coronary artery bypass graft, before I was even born. And I think some of my earliest memories were being really excited to check his blood sugar for him. I didn't realize at the time how strange that was, but I think it just goes to show that I was pretty interested in medicine early on, whether I knew it or not. And I was able to accompany my parents to their own appointments with their primary care providers and whatnot throughout my childhood. And I think this early exposure just showed me what the physicians were there to do, basically. And this got me excited about the field of medicine and how it was helping my loved ones and could help myself as well. I also was able to kind of understand that in my community, there's a lot of illness, and with that illness comes, of course, reliance on medicine. And having seen that from an early age definitely garnered my interest in medicine as well. And more specifically within the community, I think it's important to recognize that there are higher rates of chronic disease, as well as substance use disorders, and higher rates of suicide as well in tribal communities. And I don't mean to paint a negative picture of these communities by any means. I think that it's really important to emphasize kind of how these disparities came to be in the first place, whether that be through limited resources, such as living in food deserts with reduced accessibility to healthy foods, places to exercise, or whether that be because of poverty, making it more difficult for people to afford to live the typically recommended healthy lifestyle. I could do a whole nother presentation on those issues alone, but for us to be concise today, I'm not going to get into that, but I just want to make sure that it's understood that although there's illness, there are historical reasons why that illness exists. Just to throw out a couple statistics, Native Americans do have the highest prevalence of diabetes in the United States, more than twice the prevalence of diabetes among non-Hispanic whites, as well as 50% more likely for Native American individuals to have obesity. The life expectancy for Native Americans is even 4.4 years less than all US races. These are just a couple of numbers to kind of paint a picture of what I mean when I say that illness was prevalent in my community. And with that illness, coupled with the idea that in a tribal community, everyone is very close to one another, it's very tight-knit. We all think of each other as relatives, no matter how far removed we are in our family trees. This led me to be present at a lot of funerals throughout my childhood, or throughout my entire lifetime. So in my 25 years, I have gone to probably more funerals than most people attend in their entire lives. I think this is pretty common for many Native Americans who grew up near their tribal homelands. So this is all just to say that I saw a lot of illness, and I wanted to be a part of addressing that in my future. And something else I've realized throughout my lifetime is that traditional medicine and ceremonial medicine that I was part of as a child and today showed me that with basically that the goal, whether you're supporting Western medicine or traditional medicine, is to maximize wellness. And I think that emphasis on wellness within my community, although maybe the methods are different, still instilled in me a desire to want to heal others. This is just evidenced by some initiatives in my community, such as our fitness center, our community center. We have our own tribal garden that grows traditional medicines and foods, as well as many activities available to our youth to keep them active. And I think that these initiatives were very formative in showing me the importance of taking care of oneself, and kind of lending that to my, dedication to helping others achieve health in my own personal life and career. And then lastly, I kind of wanted to touch on just my own personal drive to want to help others, specifically to serve my own people and my community. And I think that a lot of that started at home, because my mom, she was on our tribal council for many years, serving as a leader of our tribal community. And I think having a role model like that available to me throughout my life really inspired me to want to serve my people the same way she did, which I did start doing from a young age during my time as royalty for our tribal community, and hopefully as a role model as well for our youth. And lastly, but not least, a large part of why I wanted to become a physician specifically is because prior to going to college, actually had never met a Native American physician at all. And I thought that was a huge problem. I really think that I was missing finding myself in my physicians, and I wanted someone who not only looked maybe more like me, but more so could relate to me on some experiences that other individuals might not be able to understand as well. And I think everybody, whether you're Native American or not, I think can relate to the idea of wanting to identify with those who are taking care of you or who you're seeking help from. So I thought, what better way to do that than to become that physician myself. So here I just wanted to kind of give an idea of how I was able to make these dreams a reality. I think even though I had that drive, even though I knew that I was interested in medicine, there were many, many times throughout the path that I wasn't sure that I had what it took to be a medical student or what it took to get to the role of physician. However, I had a lot of people rooting for me who never doubted that I could do anything that I set my mind to. And being in the position that I'm in now, I realized just how essential it was that I had that support system and how lucky I am to have that still. Of course, my main support was my immediate family, but I not only have them, I also have an entire tribe who is just rooting for my success throughout this entire process. I just made a couple bullet points here to break down a couple of the people who I think were especially essential in my success. I mentioned my family, both my immediate and extended family, as well as the Prairie Island Education Department. The Prairie Island Education Department consists of liaisons at all of the schools in the neighboring town, as well as initiatives to kind of provide support and incentives for students to want to succeed. So I personally have a great relationship with our liaisons, especially Paul Dressen. He has become known as Uncle Paul to all of us children on the reservation. And I think if I was able to introduce you to him today, he would probably be sure to tell you all that I'm his brilliant niece. And he's been saying that to me ever since I can remember. And I think having that has made me realize just how necessary it is for children to hear those words of encouragement early on, even if no other resources are available to them. I think that is just, it goes a long way and it sticks with the children just like it has stuck with me. And I think that has been a really beautiful relationship that I'm lucky to have. Up here in the top photo, you can see actually a graduation ceremony that occurs for every high school graduation in Red Wing, which is the neighboring town to Prairie Island Reservation. And I think that this collaboration between the Red Wing School District and the tribe has been a really beautiful relationship. This is actually a photo from my younger brother's high school graduation. And I think it has been just such a motivation to know that there's going to be some type of recognition at the end of the finish line, something to keep you encouraged as you're graduating. And younger children also attend this ceremony and can see their older relatives succeeding. And I think that alone, having those role models up on a pedestal, so to speak, is a great motivation as well. Throughout my childhood, I did attend summer school on my reservation too. And when I say summer school, you probably think of the typical mandatory type of summer school that you do when you fail classes, but that wasn't the case. The summer school was actually just, I think of it as basically a fun day camp that I was able to attend as a child throughout my summers. And during that time, we were taught just additional education on top of what we received in the classroom throughout the school year, as well as being able to do driver's ed classes there, to do activities with our relatives outside, involving both the traditional education as well as some experiences that are more unique to life on the reservation and learning about our culture as well. So I think that having that available to me was very, I think, formative in being able to incorporate my culture with my education. And like I mentioned, I did go to school at the University of North Dakota, where they have an Indians into Medicine program. And this program really was helpful to me because it allowed me to connect with Native physicians, which I had never done before prior to college. I was able to get some connections with practicing physicians in North Dakota that I was able to shadow. And those experiences definitely were necessary for me to decide whether or not medicine was something I could imagine myself doing, to just see what is out there in the field of medicine and what might be of interest to me moving forward in my career. And most importantly, just showing me that there were other individuals like me who were doing this, and to give me that peace of mind of knowing that if they can do it, why can't I? So that photo in the bottom right corner is after my college graduation at the University of North Dakota. They also host a separate graduation ceremony for their Native American students, kind of similar to what my high school did. And on the left, there's a photo of my parents, my younger brother, and I at my tribe's graduation ceremony, recognizing the graduates, which I attended after graduating college. And if there's one thing I always strive to be, it is honest. So I want to speak candidly about a pretty unique resource that I had available to me. I think it would be a bit naive of me not to mention how impactful this has been. But in my tribal community specifically, we're relatively unique in that we have achieved great financial success. And with that, I have been able to receive an income from my tribe. And as well as that income, the tribe also provides an education fund to all of its members. So what that means is that the tribe is willing to pay for my education as long as I finish. If I were to quit school in the middle of a semester or something like that, then the onus is on me to pay that back. But I think this has been one of the greatest advantages that I've had going into higher education, is being able to not have to worry about how I'm going to pay for my school. And I recognize that not having that stress is a major reason why I was able to comfortably take the leap into medical school. And I didn't know exactly how this path was going to work out for me, but I knew that giving it a try wasn't going to put me in financial danger or break the bank. And I'm very, very aware that not many people can say that. I would say that probably for a long time, I felt a sense of shame for that privilege. This is probably because there are already existing stereotypes about Indigenous people living off of handouts and so on. But with time, and maybe with some wisdom as I've gotten older, I'm not sure, I've been able to come to appreciate that the reason my tribe is able to give me these advantages is because of generations of sacrifice that came before me. And personally, I believe it would be a shame for me not to take advantage of the work that my ancestors put in to make sure that I can make the most of these opportunities that they didn't have. And I'm very proud now to be able to say that their sacrifices have given me such a beautiful gift. And I was also reminded by Guthrie, who can't be here today, that having financial liberty doesn't negate all of the other hard work and the qualifications that I needed to meet to make it to medical school. And I think sometimes that's a reminder that I need to hear. But like I said, I just think that it's very important to highlight this. And I want to clarify that this financial situation within my community doesn't reflect that of most Indigenous communities or reservations. And it would require a whole other discussion to highlight all the disparities and poverty that exist across Indian country. So I'll leave it at that. But I just want to be clear that I recognize my circumstances are unique and that not all Native Americans are going to school for free. But you can see here, I did highlight a bullet point, scholarships. That was a reminder to myself that I wanted to mention that although lots of Native American individuals don't have the financial liberty that I do, there are also other resources available, such as scholarships. And at Mayo Clinic, there is a scholarship specifically for Native American students that can mitigate the financial burden and provide them with the flexibility that they need to end up in this position. I'll be touching on that more later, so I'm not going to dive too deep now, but I just thought that when I'm speaking about my why medicine, I couldn't discuss it without mentioning this. So next, now that you have a better understanding of kind of why I chose this journey into medicine in the first place, I'd like to kind of talk about some issues or bumps in the road along the way. Some of these involve my own personal conflict, others involve conceptions about medicine and Mayo Clinic within the Native community overall. So an obstacle that I faced myself, my own internal conflict, has to do with just this idea of wanting to serve my people, serve my community directly. I think something I hear a lot when I'm able to get home is, wow, we can't wait until you get to be our doctor. You're going to be the best doctor. We can't wait till you're back. And, you know, I've realized throughout my time in medical school that I don't know that my future career is going to lend itself to me serving my community and moving back home to the reservation and being a physician practicing there. And I'm still pretty undecided about what it is I want to do with my career in medicine, so I can't say that for sure. But in general, I just can't promise my relatives that I am going to be home working on the reservation. And I think with that comes a lot of guilt, especially because I've been provided this opportunity because of my community. I feel a sense of obligation to the community and serving them. Another problem that has arose a few times throughout my time in medical school is just personal loss and grief. So I actually lost my cousin who was more like a sister to me, just a few months before I started the medical school application process, actually just about a week before I left for a medical mission trip as well. And during that time, there was a lot of doubt about whether or not I could even apply to medical school, just given the emotional toll that had all taken on me. I was feeling very burnt out, very exhausted. It happened right before finals week even. So I was concerned that even if I wanted to go ahead and apply to medical school at that time, that my grades were going to suffer, and that because of that, it wouldn't have been as good of an idea for me to apply at that time. So just a lot of self-doubt, a lot of questioning myself and whether or not this was something that I could do. And now being in Arizona, a new problem is that I miss home a lot. And it really stinks to miss out on my community's events, such as the powwow, such as family events. My younger sister, she's having a baby next month. It's been really hard to be here and not be able to be part of her pregnancy. Just things like that. When you grow up being so close to not only your immediate family, but your neighbors, your relatives all around you, it's really hard to go without them. And I think that that's something that is a pretty universal experience across Indian country. So I recognize that I'm not the only one who feels that way, whether you leave your tribal community for work, for family, for school, no matter what, it's not easy. Another obstacle, category of obstacles has more to do with the perception that many Indigenous individuals have of Western medicine. There's a very sensitive history between Indigenous communities and medicine. For example, just only a couple decades ago, there was the issue of forced sterilization. I'm not sure how much you all know about that, but that's just one example that comes to mind. There's the issue of the existing health disparities that are very prominent. And I think some people may believe that if we have poor health outcomes anyways, then what's the point of going to see the doctor? There's a lot of just general uncertainty about what the physicians and the healthcare professionals in general are able to do for the Native population. I think another issue is just feeling maybe misunderstood or disrespected by the healthcare professional community. There are a lot of differing ideas of what it means to be well. I would say traditionally within Native American communities, there's a very holistic view of what it means to be well, including both spiritual and physical health. And there's a conception that in Western medicine, a lot of the focus is on problem-based care and treating those problems once they're already there, rather than preventing them from becoming an issue in the first place. So there's just differing ideas and differing opinions, and this ideology is definitely amplified with the relationship between Indigenous people and Mayo Clinic. So within Mayo Clinic's history, there is a lot of, I guess I can give an anecdote to kind of support this claim that I'm trying to make, but Mayo has a history specifically with Marpia Te Najin, who was a leader of a Dakota community, and he was actually part of the 38 Dakota men who were hung in Mankato, Minnesota. And I'll be diving into that a bit later, but this is the largest mass execution in US history, and it occurred in Minnesota in the 1800s. And following that execution, it was a problem that became apparent was that Mayo Clinic, the Mayo brothers, were using remains to further medical education. So they used the remains of Marpia Te Najin specifically for medical education and held on to those remains for many, many years until they were returned more recently. But this history has kind of left a divide between the Native communities in the Minnesota and Midwest area and the Mayo Clinic. And I'll touch on how the Mayo Clinic is kind of trying to address that later in my talk. But basically, this is just going to show that not only is there distrust toward medicine in general, but the wounds that the Mayo Clinic inflicted on the community, my community and communities around it, are still there today. And that was something that really played into my decision when I was considering whether or not to come to the Mayo Clinic for school. You know, if there's always going to be the question of if this organization harmed my community in the past, is it an organization that I really want to be part of? And ultimately, the efforts that the Mayo Clinic is making today gave me the reassurance that I needed to know that they're trying to reconcile those differences, and the Mayo Clinic wants to put their best foot forward in establishing relationships with the Native people around their campuses today. And I think that in itself speaks volumes about their taking accountability for their past actions. So this slide is going to dive into kind of how I overcame and coped with these obstacles that arose throughout my path to medicine. So when it comes to the personal conflicts that I mentioned, I think I've come to realize that serving my community can look many different ways. I don't have to actually be at home on the reservation to serve my community, although that would be ideal. Even if that isn't how things play out in my future, I've kind of found peace in knowing that I'm still able to serve the community indirectly just by being here and by serving as a role model for the other youth and showing them that if this is something they want to do, it is something that they are completely capable of. And even if they don't want to go into medicine, just showing them that they can succeed in higher education or whatever else they might be interested in pursuing in their lives. I also was able to capitalize on some really amazing resources that are available here at Mayo Clinic in managing my grief and the emotional toll that took on me prior to starting medical school. We actually have care resource managers here who will connect you with mental health professionals, and they do all the work for you in terms of finding a mental health professional and getting you connected, because time is limited in medical school, and I don't think I would have known where to start trying to find that help myself, being in a completely new state, new surroundings. And, you know, they took that stress out of it, and I've been able to see a therapist regularly, which has really, really helped me manage all of the, you know, the life things that have happened during school, and just recognizing that life doesn't pause for medical school or for your career in general. And giving myself the grace to understand that before I'm a student, I am a human and I have emotional needs that I need to meet. Another way that I've coped with the personal conflict is just being sure to stay connected to my family, to my relatives. I talk to my mom almost every single day, and I think that has made missing home a lot easier. And I've been able to create really beautiful relationships here in Arizona as well. Before I even started school, I had been reached out to by some Native American medical students, Chris and Nicole. They had emailed me, and I just felt a lot of peace knowing that they were here succeeding, and that they were comfortable and happy here. And it made me think that if they were able to do that, there was no reason for me to be concerned that I couldn't do that for myself once I was here. And aside from the Native American medical students and their support, I've also made just beautiful friendships within my class. And I've said it 100 times and we'll say it 100 more times that I think if it weren't for those friendships that I've made, I don't know that I would still be here. I might have taken a leave of absence by now, or had to just throw in the towel altogether, which I hate to say, but if I'm being honest, that is the truth. And I think being able to establish connection and support has been absolutely essential in my path to medicine. Overcoming that general distrust amongst Native Americans toward Western medicine that I mentioned, what I've found has been really influential for me is just being able to create common ground. I feel like by being a Indigenous person in medicine, I'm able to kind of show that, you know, we're not all bad, for lack of a better word, that there are health professionals who care and who are going out of their way to try to understand the Indigenous experience, and that there are other Indigenous health professionals who are trying to bridge that gap. And I think that is an amazing thing that kind of helps me sleep at night. I also think that something I've grown to become passionate about is just raising awareness amongst health professionals and my classmates about the history of Mayo Clinic and medicine in general with Indigenous populations. And I think that just with bringing awareness to those topics, it can create a lot of I guess, motivation on healthcare professionals' part to want to better understand the people that they're taking care of. I also try my best to make myself available as a resource for my relatives. Of course, I'm not a physician yet, so I can't give medical advice, but I like to try to answer any questions that come up when people are unsure about their medical treatment, or when they have these ideas that maybe physicians are just pushing pills and not actually trying to get to the bottom of the problems that they might be facing. I try my best to explain to my relatives why certain decisions are being made by their physicians, and how the protocols in medicine have came to be. And I think by just providing that education and creating better understanding, this hopefully can expel some of the misconceptions and distrust that exist. I mentioned previously as well, but I want to highlight again that I believe there are some differences between Western medicine and traditional medicine, but I think that they both have the same goal. The goal is to create wellness and to provide comfort to people when they are not feeling their best. And I think that there's a role for both traditional and ceremonial medicine and the medicine that physicians typically imagine when they think about the clinic or hospital setting. And I think that by making sure that our Indigenous patients know that their traditional medicine is equally valuable and is still important, despite them maybe needing some treatment through Western medical routes, we can create a relationship that is mutually beneficial between Indigenous individuals and the healthcare community. And then when it comes to the Mayo Clinic history, I just wanted to give a little bit more information about Marpia Te Najin. So like I mentioned, he was a leader who was executed in Mankato, Minnesota. That was in 1862. The execution followed the Dakota conflict in Minnesota. This actually resulted from some treaties with the United States that restricted Dakota people to land that wasn't able to support their population. The Dakota people were facing winter in Minnesota, which I'm sure many of you know is very brutal, and they were facing starvation as well. The treaty provisions that were promised by the federal government at the time weren't delivered, which led to an uprising by the Dakota and eventually the execution of 38 Dakota men. William Mayo, he was among the physicians that took bodies from where they were buried after this execution, and the remains of Marpia Te Najin were actually kept by the Mayo Clinic until 1998, so for many, many years, which was basically a slap in the face to his community and the Native population in general. So what Mayo has been doing to kind of reconcile this and to make amends is that they created the Marpia Te Najin Scholarship, of which I'm lucky enough to be a recipient. This scholarship was suggested and supported on behalf of Dakota leaders, including Art Owen, who is from Prairie Island, my own home. And basically, this partnership was meant to enhance the relationship between Mayo and the American Indian population. And the scholarship, I learned from Guthrie, was intended to be for any Native American applicant. So like I mentioned previously, my tribe will pay for my education. So when I was given the opportunity to receive this scholarship, I made it very clear that if there were any other Native applicant who could use it, then I would rather it go to them, because I knew that my school was going to be paid for regardless. But Dr. Baines specifically advocated that regardless of whether or not a Native student was able to pay for medical school, they should still be eligible for this scholarship, because the Mayo Clinic owes it to us as an apology and as a means of showing their dedication to improving the relationship with all Native communities moving forward. And this is in large part why I decided that I wanted to go to Mayo Clinic, because I was so impressed at their dedication to trying to not only verbally apologize, but actually showing commitment to taking actions moving forward to better the relationship between them and Native communities, and to make these opportunities available to Native youth. In addition to the scholarship, there's also a Native American pathway program for undergraduate students who are interested in medical school. And this was started by Dr. Baines. I'm not sure if he's here on the call today, but I know I'm shouting him out a couple of times, because he goes out of his way to create all of these programs and opportunities basically on his own free time for free, which is just incredible, because he himself is a practicing physician and is very, very busy. But the Pathways program, it provides a five-week opportunity for Native American students who are interested in medicine. And within this program, they are able to work on medical school readiness and career exploration. They get introduced to scientific research and clinical observation. They are able to receive help with preparing for the MCAT, which is the medical school entrance examination. And All of this curriculum is delivered with regard to Native American identity, to resilience and well-being, and the instructors come from diverse backgrounds that include Native American professionals and tribal elders as well. So I think this is just a very culturally informed program that has an aim of kind of alleviating some of the gaps that exist in the medical education today, specifically for Native American students, as well as focusing on education. The Mayo Clinic has also taken initiative to create, foster a good environment for Native American patients as well. So there is establishment of patient navigators who help guide Native American patients of Mayo Clinic, both in Arizona and Minnesota. And in Minnesota, there's actually a designated spiritual space on the St. Mary's campus that is named after Art Owen. And in this spiritual space, individuals are able to go there for cleanses and to practice traditional and ceremonial medicine while they're receiving treatment at the Mayo Clinic. I don't believe that something like this currently exists at the Mayo Clinic in Arizona, but I think that starting out in Minnesota is it's a great way to get the foot in the door, and I hope that this can serve as an example of how we can integrate traditional and Western medicine together, and hopefully other organizations will follow Mayo's lead in doing this in the future. So with all of that said, I kind of just wanted to touch on a few of the things that I think are key takeaways from everything that I've shared with you so far. I do want to reiterate that my experience is not universal, but I do hope that it could still highlight some of the challenges that are common in Indigenous communities and that other Native American students might be facing. But the first key takeaway is that this takes a village. And I think regardless of whether or not that village is your family or a village that you're born into or a village that you create along the way with relationships that you forge, this is just not an easy path for anybody, whether you're Native American or not. And I think having people that you can lean on and loved ones to support you along the way is such a great advantage and is so necessary. I can't imagine doing this on my own. And another takeaway is mentioning again that I had so much support throughout my entire lifetime. I always joke now that had even one person doubted me or told me that I was too dumb for medical school or that I couldn't do this, my path probably would have looked a whole lot different. And I'm very lucky that I always had so many people basically speaking my success into existence. And, you know, I truly do credit them for manifesting my current position here in medical school. And I think this just goes to show that a little support for our youth can go a very long way. And that doesn't need to be formal support. It can just, I think it can come from anywhere. I think anybody can take advantage of any opportunities that they have to encourage the young ones around them and to remind them that they can do anything they put their mind to. Another takeaway here is that life is not going to pause for your career or for any of your dreams. And just to remember that taking care of yourself is important. And especially in the field of medicine, if you want to care for other people, you need to take care of yourself first so that you're able to show up for those people the best that you can, and so that you can give them the best version of yourself. And lastly, I just want to kind of leave off with the acknowledgement that although I mentioned a lot of great initiatives that are being put into action now, there's still a lot of work to be done. I wanted to highlight a couple of statistics here just to leave you with some food for thought. So the number of American Indian and Alaska Native medical students and physicians is very, very disproportionately low. Almost 2.09% of the United States population does identify as American Indian or Alaska Native. And despite that percentage, only 0.2% of people that were entering medical school in 2017 identified themselves as American Indian or Alaska Native. Of over 18,000 medical school graduates, only 20 of them were Native American individuals in 2017. So these numbers are pretty eye-opening in showing that when it comes to this idea of that I can speak on for myself, of wanting physicians who look like me or who have experienced similar upbringings as me, there's a huge gap or lack of individuals that are able to fill that role. So my hope is that by myself being here, I eventually can contribute to these numbers improving and pave the way for other students who also are passionate about changing these staggering statistics. And of currently practicing physicians, only 0.4% of physicians identify as American Indian or Alaska Native. And I would love for that number to be closer to 2.09% at least, so that it can reflect the population of the United States. But, you know, it is slow progress, but I'm hopeful and optimistic that it will continue to be steady progress. And here's just a quote here that I often remind myself that we, or I, and my ancestors' wildest dreams. And I think that's kind of a guiding statement for me, and in remembering that I'm so lucky to be where I am today, and that this opportunity did not come to me without great sacrifice on part of my relatives and my ancestors. And I just try to remind myself of that whenever the bumps in the road feel like they're maybe getting too big to overcome. It's thanks to their sacrifices that I'm able to complain about these rather trivial issues that maybe come my way. And that is all that I have here. I just wanted to say thank you again for everybody who gave their time to listen today. Especially to Guthrie and Karina for organizing this Indigenous Health Topics series and for inviting me to share my story. I also wanted to thank Dr. Baines again for his continued efforts in creating opportunities for Native American students and doing the work that is necessary to alleviate these healthcare disparities and disparities in medical education. And once again, to my ancestors who paved this way for me. And last but not least, my relatives who have encouraged me every step of the way. With that, I will go ahead and open the floor for any questions that you might have. And I know that following this session, we're also going to be having an informal discussion. So if you do have anything that you would like to discuss or ask me, I'll be there and would love to hear any thoughts, questions, concerns from all of you. Thank you.
Great, awesome. Thank you so much, Lexi. That was such a beautiful presentation. Thank you for sharing your journey to med school. I know a lot of other students can relate to some of the conflicts you had mentioned in your presentation when it comes to leaving your community and home. There are a lot of decisions you have to make, and sharing that and being vulnerable about it is I know sometimes difficult, but I think important for other individuals, especially students, to know that it's still possible to be successful away from home. And also for sharing the Mayo Clinic support resources and Mayo Clinic's commitment to our Native communities. So we do have a few questions in our Q&A that I can get to. This isn't necessarily a question, but it's a comment that Valerie had put in our Q&A. So Lexi, I think you will be an important voice for Natives. Please help HCP realize that we have a lot more comorbidities than all other groups. I had a HCP ask me if a patient was telling the truth about losing 3 close family members in less than a year. Definitely very important to highlight what you had discussed in your presentation. And then also a question here, did you choose to go to Arizona for med school among other schools?
Yes, I did choose to go to Arizona. When I was applying to medical school, I was basically between Mayo Clinic and one other school that happened to be on the East Coast. And I not only did I not feel super excited about the idea of living on the East Coast, which kind of helped me make my decision because I thought I would be comfortable here in Arizona, and I really loved the city of Scottsdale and the climate here. But like I mentioned, I felt very strongly about the Marpia Tenaji scholarship that was offered to me. Even though I would have had my school paid for regardless of whether or not I had this scholarship, I just thought that it spoke so loudly about Mayo's commitment to Native American medical student success that I was able to choose this school, feeling very comfortable and like my contribution to the school was going to be valued, which is why I chose to come to Mayo Clinic. And then specifically why I chose Arizona rather than the Rochester Mayo Clinic campus is just because although I love being close to my family and my reservation, I was really excited for a change. Having lived in the Midwest my entire life, I thought that coming to Arizona and just getting out of the cold, at least for even just a few years, would be an opportunity that I didn't want to pass up. So that's how I chose to come here.
All right, and another comment here from Valerie. Mayo has been most welcoming to medicine men and spiritual healers here in Rochester. Please continue to advocate for our people. Okay, and then a question, what is a typical day for you like, and what is your current favorite class?
So here at Mayo, we have a condensed curriculum, which means I finished the preclinical classes in 18 months. So I'm done with that phase of my education. But my favorite class during that time was probably anatomy, even though it's really hard. I really liked working with the cadavers and learning the body inside and out. And I think it was probably the time that I bonded the most with my classmates, because we were all just so exhausted constantly at the school together. So even though it was hard, it was a lot of fun. And my typical day now, I finished my family medicine clerkship and am currently between clerkships. So I'm kind of on break at the moment. So my typical day now looks like a lot of rest. I'm trying to take advantage of having this downtime. But I'm working with a few of my friends on a research project that doesn't take much of my time now, but gives me something to keep me on track and stay busy. And I'm going to be starting my internal medicine clerkship on Monday, actually. So I'll be getting back to the grind soon. And at that point, my day is going to look like long days in the hospital, working alongside physicians. So that question has a very different answer depending on which phase of medical school I'm in. But currently, my days are very relaxed.
And I think we have time for one last question before we move over to the informal discussion. So I have a question from Trudy. What is your input of the federal government not fulfilling their treaty obligations to American Indian Alaska Native communities by providing adequate health care across Indian country?
That's a very big question. So I think I will say that when I talk about there being distrust amongst Indian country toward the medical community, I think that's a large reason why. It's because Indian Health Services exists, which is a federally funded healthcare for Native American individuals, but many Native people will tell you that IHS has really dropped the ball and does not provide optimal care. And I think that's a huge problem and is another reason why I think it's especially important for Native American individuals to want to go into medicine in the first place, because I think as Native Americans, we are more likely to go serve those communities that are underserved currently and to return home to our tribal lands. And I think that would help address a lot of the problems that exist, just because there's a shortage of physicians who are working in Native American communities now. And then another thing that comes to mind with that is that I think it's as a medical student, speaking through the medical student lens, I think that that problem just highlights the need for more Native American students to go this route, because it's a shame that these problems exist, but I think who better to speak about these problems and to implement change than the communities and the community members themselves, the people who are facing these problems. And I think if more Native Americans could get a seat at the table to discuss these problems, we'd probably come up with better answers, or at least be able to emphasize the importance of answering these questions and solving these problems. But right now, I think there's just a massive lack of urgency to address the issues that currently exist. I don't know if that answers the question, but it's a big issue.
No, thank you. Thank you for that answer. So I know we're at the top of the hour, so I just want to thank you again, Alexi. You did have quite a bit of comments, just everyone enjoying your presentation. So hopefully we have individuals able to jump into the informal discussion. I did drop in the chat, the link to that next Zoom session. So you can go ahead and click on that. But I also wanted to share this PowerPoint slide. If you could all just please complete our short survey to provide feedback on our speaker series. If you have a phone or anything, you can scan the QR code here and that would pop up. And then also want to let you know that all of our past presentations and this presentation will be posted on our Native American Community Outreach website, which I had shared the link as well previously. And then our next guest speaker will be on May 18. So we look forward to seeing you all and joining us. Lexi, if you just want to share one last word, feel free to do so.
Yes, I just wanted to thank everybody for the kind comments in the chat. I know I don't have time to respond to all of them individually, but I tried to read them all really quickly here. For those of you in the chat who did mention any questions or wanting more information, please feel free to email me. My email address is in my slides, but I'm also going to send it in the chat now so you can save it, because I'm not sure if I will have access to these comments after the meeting ends. So please reach out to me. I'll be sure to respond.
All right. Well, thank you all, and we will see you at the informal discussion. Thank you.